Hi, good afternoon. Dr. Rakesh Jain here. I'm a Senior Consultant Pediatric Neurologist, Fortis Hospital Gurgaon. I have done my training in the UK. I have done like MBBS and post-graduation from India. And then I spent about 11 years in the UK. I was consultant in Oxford before I came here in Fortis Hospital. So today I will talk about headache. What the headache is, whether headache happens in children or not, if the child is having headache, what to do, what are the general measures, what investigation we should do, and how to treat the headache. It will be a small video and I'll try to cover it within 10 minutes if possible. So what are the headaches? Can children have headache? Most of the time I have seen, parents come to me like my child is complaining of headache, but we are surprised, can he have headache or he's just putting it on? That's not true. Children, they are very honest, they're very innocent. If they are complaining of anything, then that's true. That is absolutely true. Children do have headache, and you will be astonished to hear that child of 1 year of age can also have headache. And it is basically problem with us. Whether we understand it or not, whether we can treat that or not, it's our problem, but the children can have problem. Okay. So headache is not uncommon in children. It can be of any type. So briefly, I'll talk about types of headache. One is, we call it acute headache. Acute headache, any one of us, adults, children can have it, particularly at the time of, let's say, we have fever, sore throat, general viral infection. So headache could be part of that general illness, but that is generally short-lived. It lasts for hardly 4-5 days and disappears with the general illness. If your fever gets away, your headache also goes away with it. So not a big problem, and generally children, they do not come to me when they have headache with viral infection. What are the other types of acute headaches? Sometimes we all have tension. Children can have some sort of stress in school or something. They might have simple headache. If it is one-off headache, they come to you as they have headache. Let's say we have given some painkiller, paracetamol or ibuprofen, whatever people have been using in household as prescribed by a physician. You could use that, and if headache subsides, fantastic. Nothing to worry about. As long as scholastic performance of the child is fine and the routine of the child is not disturbed, then we are not much bothered about this very small episodes of acute headache. When should we worry? We should worry when the headache is persistent or it is recurrent. Persistent means if the headache stays, it doesn't disappear, then it is a matter of concern. I will talk about the last what are the red flag signs, when to worry, what are the signs to rule out if there is any tumor inside the head. First, persistent headache. What is persistent? If it is continuous. What could be the cause behind it? There could be some pathology inside the head. Let's say any swelling, tumor, anything could be there. It could be stress, extra anxiety, some parental history of headache can also bring about those headache in children. Secondly, recurrent headache. Recurrent headache, what I mean is, headache is there today and you have taken some medicine, then headache disappears. Then you have another headache in 15 days or a month time. We call it episodic or recurrent headache. In between those episodes, the child is absolutely fine. This is recurrence. When can we call it migraine? Generally, migraine is a recurrence of headaches, like I told you. But in a migraine, in addition to headache, there can be other symptoms like sometimes vomiting or simple retching or nausea. Children with migraine can also complain of irritability, some yawning, and sometimes photophobia, like they don't like to put on lights. The flash of light hurts them more than the normal children. Or phonophobia sometimes. They don't like to have a loud music when they are having headache, or sometimes loud music can trigger the headache as well. Loud music or the honking sounds, or any whistling of pressure cooker, or some drill is going on against your wall somewhere. It can also precipitate headache in children who have migraine or who have tendency to have migraine. So children can have simple headache, they can have recurrent headache, they can have migraine. Then why should we worry? Children can also have, unfortunately, tumor. I mean, anyone is not deprived of any problem that could come to any one of us. So let's say the child is having headache every day, when you should suspect it that this could be tumor. If the child wakes up in the middle of night with severe headache, with or without vomiting, it should alarm you. You should go to the physician next morning. I won't wait at all. If the child has crescendo type of headache, like 5 days ago it was a mild headache, then gradually the headache is increasing, so much so that it is disturbing your routine now. It is increasing over days or over weeks, then it should also worry me. What else? If there is any strong family history of brain tumors, then we should also keep that in mind. Although the incidence is not very high of genetic predilection, but yes, if with these symptoms there are some genetic history, we should rule it out rather than keep worrying about it. What else? Sometimes sudden behavior change. If the child has been doing well in school, the child was fine, suddenly over a month or weeks you see scholastic performance is getting down, child is getting irritable, sleep pattern is disturbed, or the child is not sleeping, or the child is sleeping too much that he is drowsing even during the day, that should also set the alarm. So if any of these symptoms appear, then you should take the child to a physician and must make sure that there isn't anything inside the brain. So we have talked about these different type of headaches. Now, if your child has migraine, because migraine is fairly common, even in kids it is common. For basic headaches, you will do simple paracetamol and any painkiller. But with the migraine, once we have identified that this is migraine, and we are clear that this is not brain tumor, then obviously the physician will examine the child if needed. He will do the CT scan or MRI scan, whatever needed. Generally, we prefer MRI scan for brain. Once that is ruled out, let's say everything is normal, in that case let's say we have diagnosed it as a migraine, then what do? So lifestyle is very important in the management of migraine. We must make sure that we should drink enough water. Dehydration can bring about your headache. So hydration is the first thing. Second, regular food. If you stay hungry, if you skip your meal, you can bring about the headache. So regular meal is important. Thirdly, within the meal, you must monitor if there is any precipitating factors, like some food items can bring about migraine. What are they? Some people, they can have problem with the cheese products, Chinese foods, cold drinks, chocolates. So if any of these items bother you, or if you can relate that after eating or drinking these kind of things, I'm having headache, you can avoid them. That's easier bit actually. So drinking plenty of water, regular meals, avoid any trigger, whether this is food items or sometimes going out in sun can trigger headache. So if you have to go out, make sure that you wear dark goggles in the sun. What else? Screen time, sometimes talking too much over the phone, watching a mobile TV or computer can also bring it up. So make sure they should be minimum if you have headache tendency, and there should be some physical exercise. That's extremely important. And the last but not the least, sleep hygiene. Children or adults who have tendency to migraine, they can have headache if their sleep cycle is disturbed. If they are sleep deprived, sometimes the adult people, they must have realized if they have been to the party late night and they don't sleep enough, next day they could have had bad headache. So it could be part of the migraine as well. So these are the general measures that one should take to help the children with migraine. And if there is any red flag signs that I have explained, you should take the child to your nearest doctor immediately so that the child could be examined and addressed accordingly. I hope this video is fine and it will help you to identify the type of headache in kids, and it will help you to manage those symptoms. Thank you very much.